Next, we'll talk about the blood supply to the brain. And some of these structures will make a lot more sense when you actually hold a brain in your hand and start playing around and looking at some of the vessels. But I'm going to point out a structure here that's called the circle of Willis. So the circle of Willis is this connection, this loop-like connection of blood vessels that can be seen on a ventral view of the brain. So if you take the brain, flip it over and look at it from a ventral view, you can see this connection or loop of blood vessels that's called the circle of Willis. The purpose of the circle of Willis is so that there is a continuous supply of blood to the brain. Excuse me. The brain is a really vital organ. And so we don't want to risk having any interruption to the vascular supply to any part of the brain. And so what we have is blood supply that's coming from the heart and lung, from the heart, the central part of the body, anteriorly. There's also blood supply that's coming from the heart posteriorly via the vertebral arteries as well. And so both of these supplies meet or connect to each other so that if we have an interruption anteriorly, the posterior blood supply can take over. And if we have an interruption posteriorly, the anterior blood supply can take over. So it's really a nice kind of backup supply of blood that maintains continuous circulation of blood, even if there's an interruption to any one of those areas. So let's look at the actual vessels that make up the circle of Willis. The first one is the anterior communicating artery. This is a small connecting vessel that connects both halves of the anterior cerebral arteries. The anterior cerebral arteries can be seen extending here to the anterior parts of the cerebrum, specifically the frontal lobes. Then that connects to the middle cerebral artery. So the middle cerebral artery is the vessel that supplies the middle parts of the cerebrum, specifically the temporal lobe, as well as parts of the parietal lobe. And that articulates to the anterior cerebral vessel as well. So this is the anterior cerebral vessel. This is also a continuation of the anterior cerebral vessel. That connects to the middle cerebral artery. And then from there, we have the cut surface of the internal carotid artery. So if you think about the view that we're looking at this image in, it's a superior view or ventral view of the brain. So basically the bottom of the brain. And so if we think about it, the vessels that are coming up from the heart are the internal carotid arteries. They're coming up through the neck, they're going to enter the cranium, and they're going to make their way to the middle cerebral artery. So what we can see here is a cut surface of this internal carotid artery as it ascends and communicates to the middle cerebral artery. But it's basically bringing fresh blood from the carotids, which are coming immediately from the heart. Next, we have the posterior communicating arteries. So these are, again, small strips of vessel that are just branches or little communication between the middle cerebral artery and the posterior cerebral artery. And the posterior cerebral artery are the posterior-most vessels here. These are actually bringing blood supply to the posterior part of the cerebrum, which is essentially the occipital lobe in the back. And then that communicates from the basilar artery, which is a single artery that's running on the front of the pons. And then the basilar artery is really a joined or a connection of both sides of the vertebral artery. So we got two vertebral arteries that are ascending through the vertebral column. If you remember me talking about the transverse foramen of the cervical vertebra, so the cervical vertebrae were unique in that they're the only vertebrae that have those openings on either side. They're called transverse foramen. And in those foramen is where we have the vertebral arteries ascending up the vertebral column, making their way, joining together to form the basilar artery, and then communicating into their circle of Willis. So the anterior blood that's coming from the heart is coming through the carotid, the internal carotid artery, whereas the posterior source of blood, also coming centrally from the heart, is coming via the vertebral arteries running along the medulla here, and then becoming the basilar artery along the pons. So here's another view of the circle of Willis. This is a view that's looking through the cranial cavity. So we can actually see some of the foramina of the skull and how the vessels look in relation to some of those foramina. Whereas in this image, what we're seeing is the vessels in relation to the brain itself. So make sure that you have an idea of where the vessels are in relation to the brain, and then where they actually fit in relation to the foramina and the openings of the skull. So for example, we can see the sphenoid bone centrally here, and then the pituitary fossa, and that's where we have the anterior communicating artery, just as a point of communication between the skull and the circle of Willis. All right, let's move now to talk about some of the mid-sagittal structures. So if you get a nice clean midline right down the center of the brain, there are some really important key structures that we should be able to visualize, and I'll talk about what those are. So here we've got, first of all, the corpus callosum. So this thickened region at the base of the cerebrum is called the corpus callosum. This is the area of exchange between the right and left hemispheres. This is how both hemispheres can kind of speak to each other or communicate. The ventral part of that connection is called the fornix. And then in between that is where we have the lateral ventricle. So if you bear this structure in mind, I'm going to talk about the ventricular system a little bit later on, but basically the corpus callosum and the fornix are landmarks for where we have the lateral ventricles located. We've also got the interthalamic adhesion. This is where both halves of the hemisphere are kind of connected at the base. So this is a kind of a block or a thick connection that sits in between both of the thalamuses or both sides of the thalamus in order to give that midline structure. It's also going to create the third ventricle, again, another one of the ventricular compartments that I'll talk about later on, but it's going to help to understand how these spaces are being created within the brain because of the actual brain structures that are around. So on either side of the interthalamic adhesion, we have this general space here that's called the third ventricle, and the walls of the third ventricle are the thalamus. So the thalamus are the actual walls on either side, and when we put both halves of the brain together, it creates this space in between. That's what we call the third ventricle. We've also got the mammillary bodies. So the mammillary bodies are suspended down here. We can see them right below the hypothalamus. This region in purple is called the hypothalamus because it's below the thalamus, hence the term hypothalamus. This region here is the pituitary gland. So we can see the anterior and posterior pituitary along with parts of the pituitary stalk, which is the connection from the pituitary to the hypothalamus. So here's another view of that, and this is that actual stalk. It's called the infundibulum, also referred to as the pituitary stalk, which is the connection between the pituitary gland itself. And it's nice that we can actually appreciate the pituitary gland sitting in the sella turcica, or the pituitary fossa, or the hypophyseal fossa, because we talked about this skull structure, and now we can actually see the part of the brain that resides here. Another important structure is the choroid plexus, also a structure that lines the third ventricle. And I know it's a little bit hard to appreciate what the third ventricle is, and when we talk about the ventricular spaces, it'll make a little bit more sense. But another structure that's surrounding this space is called the choroid plexus, and this is the structure that actually synthesizes or makes the CSF, the cerebrospinal fluid, that circulates around in the ventricular system, those spaces in the brain, and makes its way into the subarachnoid space so that it can suspend the brain and suspend the spinal cord. So the choroid plexus is a part of the region here that actually makes the cerebrospinal fluid. So let's actually get into the ventricles and the ventricular system. So the ventricular system is this circulating area throughout the brain. It's really spaces that are found in the brain where CSF is made, it circulates, and then it travels towards the subarachnoid space. This is how we can keep CSF continually circulating. So it's made, it circulates, it's reabsorbed, it's made again, circulates, reabsorbed continually. And so the spaces within the brain that facilitates the movement and circulation of the cerebrospinal fluid are called the ventricular spaces. So there's several components to the ventricles. First, we have the lateral ventricles. There are 2 lateral ventricles. They project off on either side here. So going back to me talking about the corpus callosum and the fornix, these are kind of the walls or the borders of the lateral ventricles. Then from there, CSF makes its way through the interventricular foramen, which is an opening that communicates from the lateral ventricles to the 3rd ventricle. So CSF makes its way into the 3rd ventricle. And again, I talked about the 3rd ventricle as being the space that's around the thalamus. So on both halves, we have the thalamus, which is the wall, and then the space that's being created around the interthalamic adhesion. So we can see this tiny dot here, which is where the interthalamic adhesion is, that creates this space called the 3rd ventricle. So CSF goes from the lateral ventricles through the interventricular foramen, this tiny opening, makes its way to the 3rd ventricle. From the 3rd ventricle, it's going to go through another small opening that's called the cerebral aqueduct. So here from this anterior view, we can see the 3rd ventricle and we can see the cerebral aqueduct. So it's going to leave the 3rd ventricle and make its way to the 4th ventricle, which is the final ventricle. From there, it's going to go through the central canal and then go into the subarachnoid space where it can circulate around the brain and spinal cord. So I'm going to walk through the flow of CSF here again one more time. We go from the lateral ventricles. Right, remember, it's being made from the choroid plexus, circulating into the lateral ventricles, makes its way through the interventricular foramen, which is here. Then it ends up in the 3rd ventricle, which is here or here. And then it goes through cerebral aqueduct, another opening, which is communicating from 3rd ventricle down to the 4th ventricle. And from there, it goes into the central canal and can circulate the brain. The final topic that we will speak about here today is the cranial nerves. So the cranial nerves are 12 pairs of nerves that are coming from the brainstem in some cases, in most cases, and are responsible for a lot of our sensory and motor components to the face and head, and even in some instances to the gut as well, okay? They're also really important in terms of our parasympathetic communication. We'll talk about that when we get to the autonomic nervous system, but the cranial nerves are also involved in parasympathetic system as well. So we'll talk about each of the cranial nerves. We'll talk about a little bit about their function as well as the structural relation to the brain and to the skull. So the first nerves are the olfactory nerve, cranial nerve 1, the optic nerve, cranial nerve 2, and the oculomotor nerve, cranial nerve 3. The olfactory nerve responsible for olfaction, so that's smell. The optic nerve responsible for vision, specifically the sensory component to vision, and then the oculomotor nerve responsible for vision as well, but the motor component to vision. So basically the movement of the eyes as opposed to the actual sensory component, which is the optic nerve. Now let's look at where these nerves communicate into the skull. So we talked about some of the foramina in our skull topic, and now we're going to kind of make a connection here and talk about where some of these nerves actually travel in terms of which foramina they travel through. So the olfactory bulb travels through the cribriform plate. So if you remember the cribriform plate of the ethmoid bone, it was that horizontal bone that had the perforations or openings coming through. And these perforations allow for the olfactory nerves or the olfactory fibers to descend from the cranial cavity down into the nasal cavity, where we can better appreciate the sense of smell. Next, we've got the optic nerve, which obviously communicates through the optic canal of the skull. This is one of the features that we talked about in the sphenoid bone. And then we've got cranial nerve 3, which is the oculomotor nerve, which actually communicates through the superior orbital fissure, which is another opening that is in the sphenoid bone as well. The next 3 nerves are the trochlear nerve, cranial nerve 4, the abducens nerve, cranial nerve 6, and the trigeminal nerve, cranial nerve 5. So just to talk about these nerves here a little bit, the trochlear nerve is this very tiny fiber. It's going to be found on either side of the brainstem of the pons specifically. One unique thing about the trochlear nerve is that it wraps around the brainstem. So it's a long nerve. You can actually see it coming from around the base of the brainstem. Then we've got trigeminal, which is cranial nerve 5. This is a thick branch of a nerve because it actually divides into 3 parts. And so you're going to see it slightly further down along the pons, and you'll also see the distinct little fibers that it's branching to, making it appear much thicker than some of the other nerves. The 6th nerve, cranial nerve 6, is found at the base of the pons. So here's the pons for reference. Here's cranial nerve 3, 4, 5, and 6. So one interesting tip or way that I like to encourage students to remember this is that cranial nerve 3, cranial nerve 6, and cranial nerve 12 are found along the central midline, right along the pons and medulla. So 3, 6, and 12. Just the tip. So those are the next 3 nerves. Let's talk about where these actually traverse through the skull. So cranial nerve 4 goes through the superior orbital fissure. So does cranial nerve 6. Both of these are responsible for movement of the eyes, just like cranial nerve 3, the oculomotor. Whereas cranial nerve 5, because it actually branches into 3 distinct parts, part of that is going to go through the superior orbital fissure. A part of it is going to go through foramen rotundum, and a part of it is going to go through foramen ovale. Okay, so the 3 branches of the trigeminal nerve will actually travel through 3 different foramina of the skull. Okay, next we've got cranial nerve 7, 8, and 9. 7 is the facial nerve, a very interesting and important nerve. 8 is the vestibulocochlear nerve. This is responsible for hearing, as well as our vestibular or our balance. The facial was responsible for taste, so taste to the anterior part of the tongue, as well as motor to the face in some areas and sensory to the face in other areas. And then glossopharyngeal is going to be innervation to the tongue, not the tongue, excuse me, the pharynx, which is cranial nerve 9. Let's look at where these nerves are on the brainstem. So the facial nerve is going to be off to the side of cranial nerve 6. So right off on either side of 6, we have cranial nerve 7. Right next to that, going laterally, we have a vestibulocochlear or cranial nerve 8. And then coming down along the side of the medulla, we have cranial nerve 9 or the glossopharyngeal.